Hello, I'm Mary Ann Dalton, and welcome to Active Aging, a program devoted to exploring issues of importance to older people and people living with disabilities. Each month, we'll bring you information and resources to help you live a healthy, satisfying, and independent life.
When you get to the bottom and you find it's much too dark, all the things you once believed now seem a world apart. When loneliness surrounds you like an endless void, and the things that used to make you happy just leave you annoyed. Reverse your spiral, make it wind toward the light. Give up ideas that keep you there in your long black night. Give up ideas that keep you there in your long black night.
My guest today is Corinne Lofty, clinical social worker, senior elder care advisor, and health insurance counselor with Somerville Cambridge Elder Services. Corinne, welcome to the program.
Thank you, Mary Ann.
Corinne is here today to talk about Medicare open enrollment. So why don't you, to start off, just give us a little general background on what Medicare is, how it differs from Medicaid, and what some of the benefits are.
Sure. So Medicare is the federal health insurance program that is for people who are over 65 years and older or disabled. And it differs from Medicaid in that Medicaid is a program that is based on one's financial resources. So it's based on your income and assets in terms of qualifying. And in Massachusetts, Medicaid is called Mass Health. It's the state's name. Mm-hmm. So when you hear Mass Health and Medicaid, they're used synonymously. Okay. But Medicare is the program that is not based on financial resources, it's just based on age or disability.
I see. And so often, people hear about the different benefits that Medicare offers. What would some of there's different parts. I know there are like supplemental plans that are offered, and it's very confusing. Maybe you could talk a little bit about that.
Sure, I'll try to give a brief overview because there's lots we could go into, but I'll just give the basics. So there are different parts of Medicare. There's Medicare Part A, which covers hospital care. Part B, which primarily covers your doctor's visits. Part C are called Medicare Advantage plans, which are like HMOs where you contract with a private insurance who, instead of Medicare paying for your medical coverage, that private company would be the payer. Oh, I see. And then Part D is for your medications. And so the other type of supplemental insurance that you mentioned are called Medigap plans. And those are plans that fill in the gaps in Medicare because Medicare was never meant to be a comprehensive health insurance. There are lots of gaps. For example, there's about $1,000 hospital deductible per year. So if you're hospitalized, you first have to pay about $1,000 before Medicare starts paying. And also, Medicare pays for about 80% of all doctors' visits, and the consumer would pay the other 20%. So if you buy one of these Medigap supplemental plans, that would cover that 20% and the hospital deductible and some other gaps in Medicare.
Okay, so it would be really wise for someone with traditional Medicare to get one of these plans to be able to cover those extra costs because they can really add up.
In general, yes.
So how about low-income people? Does Medicaid help with their extra unpaid Medicare expenses?
Exactly, it does. So Medicaid or Mass Health in Massachusetts would act as that supplemental insurance. So it would it fills in all those gaps. So you wouldn't, if you have Medicaid, you wouldn't need to purchase any additional insurance, except in rare cases where, for example, if your doctor did not accept Medicaid, which sometimes does happen. But in general, Medicaid or Mass Health would act as a secondary insurance and would fill in all those gaps in Medicare.
Okay, so now it's open enrollment. What does that mean, and how does that impact older people who have Medicare or are anticipating getting Medicare for the first time?
Yes, so basically what it means is that it's a time of year when you can make changes in either your Part C Advantage plan, your Part D medication plan, or your supplemental Medigap plan. So there's all these different, pieces, and so this is the time where you can make any kind of changes. Okay. So for example, say you have a HMO plan that's covering you for all your medications and for all your doctor's visits, and you decide, well, this plan really isn't maybe the best plan for me, or I'm not sure if it is. This is the time where you can then decide to go back to original Medicare and get a standalone prescription drug plan, or you may just have original Medicare and you decide, I'd really like to try out one of these Advantage plans, one of these more the comprehensive, private insurance plans to cover all of my medical and medication insurance. So basically, it's every year from November 15th till December 31st is the open enrollment season where you can make any of these changes, and then the change you make becomes effective January 1st.
I see. And Medicare D, the prescription drug piece, I know that that's particularly important to really review at least once a year. Can you talk a little bit about that? Why is that so important to look at?
Yes, that's a great question. So the Part D of Medicare, basically it was designed so that private insurance companies cover you for your prescriptions. So in Massachusetts, we have 48 different Part D plans.
Wow, that must be confusing for people.
It is. It's very confusing. So you have these 48 different plans, and each plan has a different list of medications that they allow you, that they will pay for under their plan. And they each have different costs for each of the medications. They have different premiums, which is the monthly amount you pay for the plan. And then they have different deductibles, the amount you pay before they start paying. So there's all these factors. And so every year, each plan changes everything pretty much.
They'd want to make sure that your drugs are still covered, or if you're starting a new drug, you're anticipating starting a new drug, you might want to check to see if that's covered.
So basically, what Medicare recommends, and we as health insurance counselors recommend to people, is that every year they do a check to basically look at their current medication list and see, is the plan I'm on still the best plan for me? Because the plan may be completely different next year than it was this year. And there may be other plans that would be much cheaper overall, depending on the medications you're taking.
You could get some unpleasant surprises if you find your co-pays change or your drug coverage changes.
Yes, so. And in general, they do change. So, it can be a big shift. So that's why it's good to look each year to review your Part D plan and see if it makes sense to switch.
And in terms of the Advantage plans, now some of those will be changing or some of them are being discontinued. Can you talk about what that impact's going to be?
Sure. So there are a few plans in this area that are no longer going to be offered next year. Those plans are the Tufts PPO, and I won't go into what all these plans are because basically if someone's on one of these plans, they would have gotten letters explaining this. But just to mention the plans, the Tufts PPO and the Tufts Private Fee-for-Service Plan, as well as the Blue Cross Private Fee-for-Service Plan and Fallon Value Plans. Those are the three major Advantage plans that will not be offered at all next year. So if you are on one of those plans, if you do nothing, you'll go back to original Medicare. But what is recommended, again, is that you kind of review and see what makes the most sense for next year. Do you want to change to a different Advantage plan? Do you want to get a Medigap plan? And if you got your medication insurance through that plan, what's most important is that you now purchase a Part D plan or some kind of coverage that will cover you for medications.
Okay, so that could be a real pitfall for someone if they are bumped back onto regular Medicare, they lose their prescription drug coverage, and they lose that supplemental piece, right? Because that's being part of an Advantage plan is like having a supplemental plan, so you can potentially be hit with a lot of costs if you end up going into the hospital.
Yes,
so, okay, so that's very important for people to take those notices seriously.
Yes, exactly. It's very important to open those letters and to read them. And if you need any help with reviewing them or looking at what your options are, then to call a Shine counselor who could help you with reviewing those things.
And we'll go into that in a minute, what Shine Counseling is. But first I wanted to ask you, what is Extra Help and how is that changing?
Extra Help is a program that is for people who are lower income to help with some of the costs of their medications, both to help with covering the premium of the Part D plan and to lower some of the co-pays. So it's a really excellent program in that it can save people thousands of dollars a year. In order to qualify for a single person, if your income is below $1,373 a month, and for a couple below $1,841, you can qualify for some type of assistance. So it's very important if your income is below that to apply. And you apply through Social Security, and they have the application online on the Social Security website, and it's a very simple application. It takes probably about 5 minutes to do, and like I said, it can make a huge difference in terms of your medication costs.
Wow.
The major change that's happened this year in terms of Extra Help is that they used to count life insurance policies towards the asset limit, and that's no longer counted. So that can make a big difference for people because there is also, besides the income limit, I should have mentioned, there's also an asset limit, which for one person is about $12,000, and for two people about $25,000. So before, if you had a life insurance policy, they would count that as part of the asset.
Can really add up.
Exactly, and so for a lot of people, that put them over and they wouldn't qualify. But now your life insurance will not be counted at all towards the limit.
So that's a very important message to get out to people because there's a lot of people who probably don't know about that change and might not know to apply for that. And is this the only time of year you can apply for the Extra Help?
For Extra Help, you can apply at any time.
Oh, okay. So that's great.
Yep.
What's the Medicare Savings Program, and how does that? And that I think is also changing.
Yes. So the Medicare Savings Program is also known in this state as the Mass Health Buy-In Program, which gets confusing because buy-in, people think they're buying something, but actually what the program is it's a program where the state will pay your Medicare premium. So most Medicare beneficiaries pay this year $96.40 a month for their Medicare premium, Part B premium. And so if your income is below a certain amount and your assets are below a certain amount, you qualify for the Medicare Savings Program where the state pays that $96 for you. So basically you save about $100 a month. So, that really is significant for a lot of people. In order to qualify for that, it used to be that your assets had to be under 4,000 for one person or 6,000 for two people. It's going up, it's pretty much doubling. So next year you can have up to $8,000 for an individual and about $13,000 for a couple.
Well, that's a wonderful change. So
Yeah.
a whole new group of people will be able to qualify for that benefit.
Exactly.
And I know there's another program in Massachusetts that helps with the prescription drugs and Prescription Advantage. Can you describe
Yes.
that and how
Sure.
people qualify for that?
Sure. So Prescription Advantage is our state pharmacy assistance program. And basically, that is another program that helps people based on their income with some of their medication costs. With that program, the really nice thing about it is that they don't look at assets at all. So it's just solely based on income. And they serve people with much higher income limits than does Extra Help or the Medicare Savings Program. So for Prescription Advantage, in terms of qualifying, is for a single person, if your income is under $54,000 a year, or a couple under $72,000 a year, you would qualify for some type of assistance. So it's a wide range of income limits, of income levels.
That's good to know about because there's so very few programs that help middle class, older people.
Yes.
So this is an example of something
Exactly.
that people could take advantage of that they might not necessarily know about.
Yes, and the major benefit of Prescription Advantage is that it covers you during what's called the donut hole or the coverage gap. So that's where, at some point in the year, if your medication costs get to a certain level, your Part D plan doesn't cover you. And that's where Prescription Advantage kicks in and they cover you during that time. So it can make a huge difference for people who have some substantial medication costs.
So people in Massachusetts are lucky to have this program because I know that for a lot of
Yes.
elders in other states, there's nothing to help
Yes.
them in the donut hole.
Exactly. So it can make a big difference. So the unfortunate change that's happening next year with Prescription Advantage is because of state budget cuts. One of the other benefits they offered, which was help with premium assistance, paying for your Part D monthly premium, which was about $30 a month they would pay up to, that they're no longer able to offer because of the budget cuts that they received. So they've been, a lot of people, if you have Prescription Advantage, they just sent out letters to everyone explaining that what that change is and what it means for them. So a lot of people who did not used to have to pay a monthly Part D premium are now going to start getting bills from their Part D insurance company and will have to be paying that themselves. So that's a big change.
So that's unfortunate.
Yes.
But they didn't change sort of eligibility criteria,
No.
and they still had that kind of emergency donut hole coverage intact.
Exactly.
So that's still positive that
Exactly.
those parts weren't touched.
Right.
And so when does open enrollment end?
It ends on December 31st. So
That's you have to have all your applications.
you have to
in
have
by
it
that day.
in by the end of the day. You can either apply for things online. All the insurance companies' websites, most of them, not all, most of them you can enroll online on the Medicare website itself, Medicare.gov. You can enroll right on there for all of the prescription drug plans and the Advantage plans. Or you can call the plans directly and enroll over the phone, or they can send you out packets and you can apply on paper. So there's lots of ways to do it.
So if you're listening to this show and you're feeling overwhelmed, what resources are there in the community to help you figure out what your best options are?
Sure. So as I've mentioned, there's the SHINE program, which stands for Serving the Health Information Needs of Elders, of which I am a counselor, is a program that's a free service that's available to any Medicare beneficiary in the state, where we can meet with you one-on-one to review what your options are, explain any information, and go over, try to make things as clear as possible given your individual situation.
And locally, who could they call to sign up for a counseling session?
Yes, so at Somerville Cambridge Elder Services, we have the SHINE program. So if you live in Somerville or Cambridge, you should call us, 617-628-2601, and just say that you would like to meet with a SHINE counselor, and we would take some basic information, and then we would have a SHINE counselor contact you to set up either a phone consultation or an office visit or a home visit.
Wonderful. So I know that the quality of these counselors is really excellent. You all go through quite an extensive training, so I think it's an important resource that people should take advantage of in the community.
Yes.
Thank you for joining us today.
Thank you for having me.
Accione USA é uma organização sem fins lucrativos que, junto com a cidade de Somerville, oferece empréstimos para pequenos empresários, entre $500 e $25 mil. Se você é um pequeno empresário e necessita de um empréstimo, contacte-nos, pois estaremos prontos a atendê-lo.
Acción USA es una organización sin fines de lucro que provee préstamos para microempresarios que no tienen acceso a capital por uno u otro motivo y que no pueden obtener financiamiento para su negocio, ya sea para expandirlo o para empezar su propio negocio. En Acción USA le podemos ayudar con préstamos que van de $500 a $25 mil, $15 mil para negocios que van a empezar y hasta $25 mil para negocios que están establecidos. En estos momentos estamos haciendo una alianza con la ciudad de Somerville para traer estos programas de financiamiento para los pequeños negociantes y además proveer otras asistencias a nivel técnico que les va a ayudar a las personas a mejorar su negocio y el manejo de su capital. Por favor, contáctenos si tienen alguna pregunta o si está interesado en aplicar para un préstamo al 617-616-1579 o al 617-625-7080 extensión 1335 y pueden preguntar por Andrés Silva. Muchas gracias.
I love the Somerville Public Library because it's a quiet place to help me study for my college exams.
I avail myself of the services of the library periodically. I like their audio books, and they also have talking books available.
I like the library because it helps me with my school projects.
I like the library because it does help me a lot when my daughter has school projects. I've been bringing my daughter since she was little for this story time.
I have been living in Somerville only since 1985, but I found the Somerville Library to be very well equipped and very up to date and very helpful.
I work full-time and I come to the Somerville Public Library because it has convenient evening hours and all the continuing education resources I need to further my career.
We like the Somerville Public Library.
Thanks for watching Active Aging. Please join us next month when we'll bring you more strategies for aging well.